Namaste. I'm Dr. Shwetha Anand. I'm a fertility consultant, high-risk pregnancy specialist, and a laparoscopic surgeon as well. I practice at Basaveshwar, Nagar at a center called Janisthaa Fertility Center and Hospital. How frequently a person should get tested for HIV, that's the infection, or for AIDS? Now the CDC, that's the Center for Disease Control, what they recommend is we have any person between the age 13 years and 64 years, they have to get tested for this virus, that is HIV virus, at least once in a lifetime. This is what is recommended. Now, when do we go ahead and test ourselves frequently without the recommendation? For example, healthcare professionals. So we are at the high risk of any kind of infection transmission, be it HIV, HbsAg, that's hepatitis B or hepatitis C. So people who are in healthcare professions and who are exposed to the virus, HIV virus, so these are the kind of people who have to go for screening. Now this comes to the medical personnel. Now what about the general public? When are they supposed to go ahead and get tested themselves for HIV? First and most important reason is whenever they have had an encounter with a person who is unknown or whose status of HIV is unknown, and this is the most important indication where they have to go and get themselves tested for HIV. Another scenario where a person is having multiple sexual partners, when them they have to go and get themselves tested for HIV. Especially men. Men are they more prone for HIV transmission. So people who have had multiple sexual partners or an unnatural intercourse like an anal intercourse, which happens very frequently in homosexual men, so they also have to get themselves tested very frequently. In a very rare scenario, what happens is if they have shared needles during their drug abuse. So these are certain things which they are not forthcoming, but in case if there's any needle sharing during any drug abuse, even then they have to go and get themselves checked for HIV infection. These are the very common indications where you have to go and get it checked. Now, how do you check for the HIV infection? So you have home tests, the rapid tests. So these actually use the presence of antibodies in the blood, and which says whether you are exposed to the infection or you are HIV positive. Another method of doing is by doing an antigen testing. Antigen testing is nothing but the presence of the antigen, the viral antigen in your blood. So this is done in specific laboratories. Suppose if the exposure has happened very recently, then you actually have to get the test for viral load in the blood. So this one will tell us whether you are prone for HIV infection or how is it. If you're doing an antibody test, there's something called window period where after the exposure of the HIV infection, it will not be detected in your blood because there won't be presence of antibodies. Antibodies take a while for it to get present. So if antibody test is performed in a window period, it will turn negative. So you need to have series of at least 3 of antibody testing in a period of 6 months for you to be completely declared as HIV free. HIV was considered to be a taboo earlier, but not now. There's so many advanced medications that are available so that you can be as healthy as other people. No one will ever know whether you're infected with HIV unless and until you go ahead and tell people. But the most important thing is early diagnosis and early treatment. The earlier you get diagnosed, you can go on medications and you can lead a normal life. So there is nothing to feel guilty about it or feel ashamed of it, and not taking proper steps at healthcare as soon as you get it diagnosed. So most important is as soon as the diagnosis is made, please go ahead and follow up with your healthcare professional because they are the ones who will help you to lead a normal life.